Magnesium is one of the most essential minerals in our body, playing a role in over 300 biochemical reactions. It's involved in everything from regulating muscle and nerve function to supporting the immune system and maintaining strong bones. Yet, despite its importance, many people aren't getting enough magnesium, which leads to a variety of health issues. But what happens when we take too much magnesium? Today, we're diving deep into the side effects of magnesium supplementation, something you need to be aware of, especially if you're considering adding magnesium to your daily routine. Stick with me for the next few minutes, and we'll explore everything you need to know about magnesium's potential side effects, how to manage them, and ensure you're using it safely. Before we get into the details, make sure you hit that like button and subscribe to Vital Age Nutrition for more insights into your health and wellness. You won't want to miss what's coming up. Magnesium is crucial, but like anything, balance is key. Overconsumption can lead to unwanted side effects that can range from mild to severe, and that's exactly what we're talking about today. Now, magnesium is generally safe for most people, and it's widely used for treating conditions like migraines, muscle cramps, and even to support heart health. But when you cross the line, things can get tricky. The most common side effect of magnesium is digestive upset. Magnesium has a natural laxative effect, which means that if you take too much, you might experience diarrhea. This isn't just uncomfortable. It can also lead to dehydration and an electrolyte imbalance if left unchecked. Diarrhea is usually the first sign that your magnesium intake is a bit too high, and for some people it's more than just a mild inconvenience. If you're taking magnesium supplements and notice loose stools, you might want to lower your dose and see if the symptoms improve. While digestive issues are the most common, they're not the only ones. Some people may experience nausea or vomiting when taking too much magnesium. This is often accompanied by a feeling of weakness or dizziness, and it can be quite alarming if you're not expecting it. These symptoms typically occur when magnesium levels in the blood become too high, a condition called hypermagnesemia. Hypermagnesemia is rare but can be dangerous if left untreated. Symptoms can escalate to more severe conditions, including trouble breathing, a slow heartbeat, and even cardiac arrest in extreme cases. Luckily, this is quite rare, and it usually happens only when people take very high doses of magnesium, often exceeding 2,000 milligrams a day, or if they have kidney problems that affect how the body processes magnesium. Speaking of kidney problems, it's important to note that individuals with kidney disease are at a much higher risk of magnesium toxicity. The kidneys play a crucial role in filtering magnesium out of the blood, so if they're not functioning properly, magnesium can build up to dangerous levels. If you have any kind of kidney issue, you should consult with a healthcare provider before starting magnesium supplementation. Kidney disease can mask or exacerbate the side effects of magnesium, and the risks are much higher. Even at lower doses, magnesium can be problematic for individuals with compromised kidney function. Another important consideration is magnesium's interaction with medications. For example, magnesium supplements can interfere with the absorption of certain medications, including antibiotics, diuretics, and drugs used for heart conditions. If you're taking any of these medications, it's crucial to consult with your doctor before adding magnesium to your routine. This can help you avoid potential complications and ensure that your supplements don't affect your medication regimen. It's also worth noting that magnesium can lower blood pressure, which might be beneficial for people with hypertension. However, if you're already on blood pressure medications, combining the two could lead to dangerously low blood pressure levels. Again, this is something to watch carefully and discuss with your doctor. Magnesium is vital for heart health, but too much of it can also cause heart-related side effects. In rare cases, excessive magnesium levels can lead to a slow or irregular heartbeat, a condition known as bradycardia. In extreme cases, it can cause the heart to stop beating, although this is incredibly rare. If you're taking magnesium for heart health or have a history of heart issues, it's essential to monitor your magnesium intake and consult with your healthcare provider regularly. It's easy to see how magnesium can be both a friend and a foe. When taken correctly, it can provide tremendous benefits for your health, including improved muscle function, better sleep, and a healthier heart. However, it's important to remember that taking too much can lead to serious side effects. If you experience symptoms like diarrhea, nausea, or dizziness after taking magnesium, it's a sign that you may need to adjust your dosage. Keep in mind that magnesium supplements are not a one-size-fits-all solution, and what works for one person may not work for another. So, what's the right dose of magnesium? Most experts recommend around 300 to 400 milligrams a day for adults, which is enough to meet your body's needs without risking side effects. However, the exact dosage depends on your age, sex, and health condition, so it's always best to start with a lower dose and gradually increase it if needed. Also, make sure to take your magnesium with food to minimize digestive upset. This can help your body absorb it better and reduce the chances of experiencing side effects. As we continue exploring the topic of magnesium and its potential side effects, it's important to recognize that not all forms of magnesium are created equal. Different magnesium supplements have varying levels of bioavailability, meaning some are absorbed better by the body than others. Magnesium oxide, for example, is commonly used due to its affordability, but it's not absorbed as efficiently as other forms like magnesium citrate or magnesium glycinate. This can affect how much magnesium actually makes it into your system and how likely you are to experience side effects. Magnesium citrate is one of the more commonly used and well-absorbed forms of magnesium. It's often recommended for individuals dealing with constipation, as it has a mild laxative effect. However, this also means that it can lead to digestive upset, including diarrhea, especially when taken in higher doses. If you're using magnesium citrate to help with digestion, it's important to monitor your intake and adjust accordingly. On the other hand, magnesium glycinate is considered to be one of the most gentle forms of magnesium on the stomach. It is known for being well tolerated, with fewer gastrointestinal side effects like diarrhea. This form is often recommended for people who are sensitive to other forms of magnesium or those who need to take it long-term. If you're worried about side effects but still want to experience the benefits of magnesium, magnesium glycinate might be the best option for you. Another form of magnesium worth mentioning is magnesium threonate. This version is thought to be particularly effective for brain health, as it can cross the blood-brain barrier more effectively than other forms of magnesium. Some people take magnesium threonate to help with cognitive function, sleep, and mood disorders. However, just like other forms, it's important to stick to the recommended dosage to avoid overloading the body with magnesium, which could lead to side effects. While magnesium supplements are widely available, they're not the only way to get your daily dose of magnesium. Many foods are rich in magnesium and can provide a natural food-based source of the mineral. Dark leafy greens like spinach, Swiss chard, and kale are excellent sources of magnesium, as are nuts, seeds, and whole grains. Fish like salmon and mackerel also provide a good amount of magnesium. If you're able to meet your magnesium needs through food, you may not need to rely on supplements at all, or you may be able to reduce your supplement dosage. However, if you are supplementing with magnesium, it's crucial to pay attention to the signs that you're getting too much. If you're experiencing unusual symptoms such as muscle weakness, difficulty breathing, or an irregular heartbeat, these could be signs of magnesium toxicity. While this is rare, it's important to know what to look for, especially if you're combining magnesium supplements with other medications or have underlying health conditions. If you suspect that you've taken too much magnesium, it's essential to seek medical attention immediately. The relationship between magnesium and hydration is also something to consider. Magnesium has a diuretic effect, which can cause you to urinate more frequently. If you're taking magnesium, it's important to stay well hydrated to prevent dehydration. This is especially important if you're also taking other supplements or medications that have a diuretic effect, as it could amplify the risk of dehydration and lead to more serious health issues. If you've been considering magnesium supplementation for sleep issues, you're not alone. Magnesium is often touted as a natural remedy for insomnia and poor sleep quality. The mineral is known for its ability to help calm the nervous system and regulate the body's circadian rhythm. It's commonly used to promote relaxation and improve sleep quality, especially for those dealing with stress, anxiety, or muscle tension. However, just like with any supplement, it's important to understand the proper dosage and any potential side effects. Too much magnesium before bed could lead to waking up in the middle of the night to run to the bathroom due to its laxative effects, so start with a low dose and adjust as needed. For people who suffer from migraines, magnesium supplementation can also be a game changer. Some studies have shown that magnesium deficiencies may contribute to migraines, and taking magnesium supplements regularly could help reduce the frequency and severity of migraines. If you're considering magnesium for migraine prevention, it's important to talk to your healthcare provider to determine the right dosage for you, as too much magnesium can worsen certain conditions. If you've been wondering whether magnesium can help with muscle cramps, you're on the right track. Magnesium plays a crucial role in muscle contraction and relaxation, and it's commonly used to help with leg cramps, especially at night. Some athletes also use magnesium to prevent cramping during workouts, but again, the dosage is key. Too much magnesium can lead to digestive issues, while too little may not provide the muscle-relaxing benefits you're hoping for. So, how do you know if magnesium is the right supplement for you? The best way to figure that out is by consulting with your doctor or a healthcare professional. They can help you determine if you have a magnesium deficiency, what the optimal dosage is, and which form of magnesium is best for your needs. They can also monitor your magnesium levels if you're taking supplements long-term to ensure that you're not going overboard. In conclusion, magnesium is an incredibly important mineral that plays a vital role in maintaining overall health. It has a wide range of benefits, from improving sleep to relieving muscle cramps, supporting heart health, and even reducing the frequency of migraines. But, like all supplements, it's important to use magnesium wisely and be mindful of the side effects. If you're experiencing any adverse effects, adjusting your dosage or switching to a different form of magnesium can help. The key is to find the right balance for your body and your specific health needs. If you found this video helpful, don't forget to hit that like button and subscribe to Vital Age Nutrition. And if you've had any experiences with magnesium, whether good or bad, drop a comment below and share your story. I'd love to hear how magnesium has worked for you and if you've encountered any side effects. Thanks for watching and stay healthy.